founder of MedigapCares.com and host of the Medigap Show. So in this video, I'm going to explain Medicare and what it is, how it works, and how you can enroll. Medicare can be very confusing, very complex for most people who are starting on it, but by the end of the video, you're going to be able to understand everything there is to know about Medicare, including the differences between original Medicare and Medigap or Medicare Advantage. So what is Medicare, first of all? Medicare is a federal insurance program for people who are 65 or older. It was signed into law in 1965. Medicare is divided into 4 parts. So you have Part A, Part B. You could choose a Part C, or you could choose a Medigap plan with a standalone Part D. It's A, B, and then you choose C, or you choose D. If you choose D, you also have to choose a Medigap or Medicare supplement plan. Your Part A covers hospital stays, hospice care, and skilled nursing facility. And you have to at least have worked 10 years in the US to be eligible to get your Part A for free at age 65. Part B is the outpatient side of Medicare. And there is a premium, and this year 2023's premium for Part B equals $164.90 for most Americans. If you have a higher income, you're going to have a higher premium. Part D is prescription coverage. So it's also offered by private insurance, but it's watchdogged by Medicare. Part D plans can vary. It's based on your prescriptions, where you like to shop, and the zip code that you live in. Not obligated to enroll, but if you do want a Part D in the future, you will have to pay a penalty for it if you didn't get it in your initial enrollment period, which is 3 months before and 3 months after your Part B effective date of Medicare. In addition to original Medicare, you can also enroll in a Medigap plan or Medicare supplement plan. They're offered also by private insurance companies, but when you do have a Medigap or Medicare supplement plan, it means you're on the original Medicare program. You're not on the replacement plan, which we refer to as Advantage plan. Medigap or Medicare supplement plans, most people will be on a Plan F if they were born prior to 1955. 1955 or after, you're either going to enroll in a Plan G or a Plan N. And those plans will fill in the gaps, hence the name Medigap, for original Medicare. Original Medicare pays 80% of your bills, and your Plan F fills in all the gaps, and you have 100% coverage. But if you're too young, if you're born after 1955, you won't be eligible for Plan F. You would be eligible for the next one down, Plan G. And Plan G, it will also fill in all the gaps of original Medicare, meaning it will pay the Part A 20% coinsurance, it will pay the Part A deductibles, and it will also pay the Part B coinsurance of 20%, but it's not going to pay the Part B deductible, which is $226. It's actually down from last year. So I have had clients over the years ask me if that Part B deductible rises every year, and the answer to that is no, because we just literally saw it go down this past year. The other way to have Medicare is what's called Medicare Advantage. It is a replacement plan. It takes you off of original Medicare and it puts you onto a private insurance plan managing your health care from age 65 forward if you're on Medicare. Or if you're on Medicare Early for Disability, you may also be on a Medicare Advantage plan. So it is a replacement for original Medicare. There are networks. You do have to make sure your doctors and hospitals take it. And there are large max out-of-pocket costs, meaning if you have a hospital stay with a surgery procedure, you may walk out or come out of that hospital situation with a hefty bill. The max out-of-pocket this year on many of the large PPO plans, in-network is $8,300, out-of-network exceeds $11,000 for the year. So that's very different than being on original Medicare with Medigap, with a standalone Part D versus the Part C Medicare Advantage plan, because Medicare Advantage is a replacement. You don't usually pay for it. It's usually $0 per month, and it does include a Part D prescription plan, as well as replace every item that you would ever have in original Medicare, meaning it does cover everything, but you will be responsible for more out-of-pocket costs versus the original Medicare with Medigap and standalone Part D. Any questions, feel free to comment down below. Love for you to subscribe to the channel. I put out as much content as possible. Happy to answer any and all questions about Medicare. I'm here to help. All right, thank you. Have a great day.